So here we're talking sciatic pain. The sciatic nerve runs right in the back of the glute, and you have a muscle called your piriformis that overlays it. During pregnancy, your pelvis does a lot of shifting, which can cause compression of that nerve, translating into sciatic and lower leg pain. Coupled with that is also sometimes some lateral hip pain because you're laying on your side during pregnancy. You can't lay on your back. So here's some easy stretches you can do at home for sciatica. Number one, you're going to sit on something to stabilize. This is not the time to be on your ball. So if I'm working my right glute here, my right piriformis, I'm going to cross figure 4. This is really nice because belly has a lot of room, a lot of space. You're going to take the other hand, your right hand, push your knee down, keep your chest up nice and long, and almost like there's a string in your sternum, lean forward. You don't want to hinge because you won't get a good enough stretch. You want to pull forward from your sternum, and you'll get a nice pull in that lower piriformis, lower glute on that right side, and then do both sides. Option 2, while you're here, and as belly gets bigger, you might have to modify a little bit, but what you can do is pull your knee in towards your chest, again, keeping that chest nice and long. You don't want to have your back supported because you won't get enough of a pull. Pull in towards your chest, rotate towards the knee that you're pulling. This might feel different than the previous stretch, but also good for that low piriformis sciatic region. Another option for sciatic pain, get your wedge. Mamas, you don't want to be laying flat on your back, so the wedge is a really great tool, one of our favorites. You're going to butt up nice and tight, lean back. If you don't have a wedge, prop up a bunch of pillows, you'll get a similar stretch. This leg, so I'm stretching my left side, is going to rotate over, letting it just fall. This gives me a really good stretch in through here. I'm propped up, belly's here, getting that side body stretch, getting into that glute, into that piriformis muscle. You can even just let it hang long, rest, be here for a few moments. Really nice for that back, that part of your pelvis. Next up, grabbing our ball, which we love. Option 1, if you don't have a ball, you can use a table or an ottoman or a couch even. If you do have a ball, keep your shoulders nice and long. This is going to be, again, that piriformis muscle in the back for that sciatic and low back pain. Stretch out nice and long, keep the booty up, and drop in this way. You can even go side to side, targeting different parts of that tailbone, but getting a really nice stretch in that low part of the pelvis in through there. Again, if you've got a table and you don't have a ball, get up on here, sink nice and low. If you're feeling a little lazy and you want a little less shoulders, get closer and do the same thing, dropping side to side. Really nice in addition to this is something simple like a cat-cow. So get on all fours, keep that booty up nice and high. We're gonna arch upward towards the ceiling, getting some length, and then we're gonna round, really pushing through our hands, rounding up into that thoracic spine, into that low back, creating some extension in through that pelvis, helping reduce those symptoms. Now we're talking TFL and IT band, really tight during pregnancy because of all the shifting of the pelvis, as well you're laying on your sides more than you probably ever have in your life. So, option 1, foam roller. Put it down, really simple. Make sure you're nice and stable. You're gonna just lay on the roller, extend that lower leg out, and then just roll all up in that side of the pelvis on that lateral part of the leg. You could even rotate almost 45 degrees. Now I'm back in that piriformis muscle we talked about earlier, working on that sciatic pain. But it's all connected, so these are a couple options for you. And do both sides. Option 2, if you don't have a foam roller, something about the height of your hip or so, an ottoman, again, a sofa works well. You're gonna get up on one arm. This arm that I'm stretching, the lower leg, is gonna be nice and straight like this. And depending on how pregnant you are, you might want to have a partner nearby to make sure that you're stable, but keep your core engaged. The top knee is going to rest over like so, and then I'm going to just sink my hip down this way. This is a really nice way to get that side leg stretch, that TFL, sinking in like that. And then lastly, for sciatic pain, what I want you to do, and I don't have a ball right now, so maybe I'll use a little water bottle to show. This is going to be, again, for that piriformis muscle. We're going to sit on something about that size. A lacrosse ball works really well, tennis ball if you have it. Sit right, your glute right on the piriformis muscle, have a seat, and then all you're gonna do is lift your knee up and then out to the side. And again, do both sides, up and out to the side. And if this is tight, you'll feel it. You'll feel that pressure localized right in the muscle belly. Really nice relief. Next up, hip flexors. Everything in the pelvis is connected. So if we're gonna do the back, we have to do the front. So, number 1, runner's lunge. We're gonna get right next to something to stabilize ourselves. Knee nice and long. You don't wanna start here because you wanna end up at 90 degrees. Knee's gonna be nice and long, chest up high. We're gonna sink forward. Knee ends up at 90 degrees. Again, I'm holding on to something to stabilize. Opposite hand goes to the knee. We're gonna push away and look over our opposite shoulder. This gets a lot of length right here in this left hip flexor, which is what I'm stretching at the moment. And you can sink in even further as you get deeper into the stretch. Couple different ways to do this if that doesn't suit you, if you have knee pain. Something about, again, the level of your knee. Maybe it's a sofa, maybe it's an ottoman. I'll do the opposite side for visual. Stabilize yourself here. Leg goes up. Take a nice step forward so you feel nice and stable. You want to square your pelvis as best you can. Hand goes here for support. And you're going to rotate opposite the muscle you're stretching. So in this case, my right side is getting that nice long stretch. If that doesn't suit you, you can go to a wall. I suggest you stabilize yourself with something here because we don't want you toppling over. The knee is going to go, one leg is going to go behind the other. So in this case, I'm stretching my left side. My upper arm is going to go over and I'm going to lengthen in through here, feeling that stretch again in that hip flexor, in this case on the left side. Now we're talking partner piriformis. Partners can be a really great tool at home to help give you some relief in that sciatic nerve pain region right in the piriformis muscle. So we're going to use a wedge, have our mama up on a wedge or a stack of pillows if you don't have a wedge. Head is supported with a bolster. We're going to grab, so in this case, the right knee, cross it over to start. The idea, partners, here is you want to bring the hip straight first, forward, and then in. And the idea is we're going to stretch that piriformis muscle underneath and being mindful of belly, giving some nice stretch with some help to help provide relief for sciatica. For our non-pregnant women, here's a couple additional stretches for sciatica that can be very helpful. So, baby cobra, we're going to get on our chest, elbows up, and this is really promoting extension in that low back, almost a little bit of nerve flossing down into that pelvis. If this isn't enough for you, option, get up on your hands, get a little longer, keep that chest up, and get a good stretch in through there. You can also even take this back really nicely into child's pose. Again, getting that length, getting that stretch in the lower part of the pelvis. Option 2, I'm going to get our favorite tool, exercise ball. And the idea is we really just want to promote, again, extension. So we're going to get on our back here, lay over it, open up that chest, hang out upside down just for a few moments here, and get some nice extension into that back, that lower part of the pelvis, as well as the upper body. Non-pregnancy option for nagging sciatic pain, again, with help of a partner. You guys can do this at home. We're going to be laying face down, grab the knee of the leg you're going to be working on. So in this case, I'm the right side. And partners talk to each other. You'll feel that muscle activate. The person face down will feel it more so than you probably. Trained hands can tell though. You can either use a thumb, get right into that muscle belly, pin it down, and I'm using a pretty good amount of pressure. And then we're going to rotate the leg outward, creating stretch, pinning it, activating that muscle to provide relief and help it settle down. If this is not enough, you can also not be afraid to get in there with a little bit of an elbow, use your body weight a little bit, get into that muscle belly, same thing, outwardly rotate the leg, pinning that muscle down, helping it relax with a technique called active release. Great way to get your partners involved.